Welcome to the Decatur Dish, where we are talking all things DeKalb County and the latest that's been happening. Dan, every Tuesday we come on here and share some of the stories that are being talked about most. And right now, a lot of folks have their minds on Hurricane Milton, especially after the devastation that Hurricane Helene caused in the area.
Yeah, so looks like we're gonna not get the brunt of Hurricane Milton, but people are still cleaning up after Hurricane Helene. It's weird we keep having these hurricanes. People should look into that. It might be something that's causing it. But we're having this resurgence of hurricanes amidst hurricane season. DeKalb County recently did the Good Neighbor Express. They signed an agreement of mutual aid with the city of Augusta, and so we sent about 5,000 boxes of food over that way. DeKalb Sheriff's Office collected some goods as well. So Atlanta, as we talked about the last show, Atlanta did really pretty well, considering what happened to some other communities. So we've been stepping in and helping our neighbors as best we can with the resources that we have. So that's what we're doing.
Yeah,
that's how we
roll. A lot
roll.
of boxes delivered directly to Augusta. Many other communities in Georgia and even in Florida are just still without power, dealing with the aftermath of Helene, especially for our neighbors in Florida. They're now preparing for what will be a strong Category 3 storm upon landfall, forecasted to be out of Milton. So really, if you have any time, whether you can volunteer or donate money, there are many communities that are trying to build back up after the destruction that we saw.
Yeah, Florida's going to be in bad shape for a little while. So keep them in your thoughts and help if you can.
We have some major events happening this weekend in Atlanta. Atlanta Pride is a big deal here. Many come together. It's a party, it's a celebration, and this story is quite timely. The United Methodist churches, some in Decatur, now changing their rules around same-sex weddings.
Right. Zoe Seiler did the story. She did a great job with it. The long and short of it is, in 2019, there was a split over same-sex marriage and same-sex clergy. A lot of people left. A lot of denominations parted ways, some because they wanted to perform same-sex weddings and some for the opposite reason. So it became a very divisive issue. Fast forward, they had another legislative conference this year and decided to give the churches a little bit more flexibility. So rather than it being a policy that applies to all the UMC churches, each church will get to decide their own rules around that. Church, it's not a secret that church attendance has been declining historically across all churches. So I'd imagine any church would be alarmed by any issue that would drive people away from the church. So this is going to give those churches in our community a little bit more flexibility to allow same-sex marriages, allow LGBT clergy. So that's really what it's about. It's kind of giving the churches some wiggle room to serve the communities that they live in, and every community is a little bit different.
And one more reason that this weekend is going to be so special.
Indeed.
If you have an opportunity to come out to Atlanta Pride this Sunday, please do so. If you can't, we are going to be live streaming that on Peachtree TV for you from noon to 4 p.m.
Absolutely.
Let's talk about the big story that really not only affects DeKalb County. We're talking Rockdale, Gwinnett, Fulton County. BioLab, the news just doesn't stop with this. We had a news conference yesterday with Rockdale officials announcing that those still living or working within a 2-mile radius will need to continue to shelter in place. We're continuing to hear reports from residents experiencing those hazy skies and smelling chemicals in the air. What's the latest out of DeKalb County?
Nothing except that we still smell it a little bit. I was walking this morning and I smelled it. I went on a trip with my son over the weekend, and I drove through Conyers going there and back, and there's this fog of smoke from the fire that is still hanging. It just doesn't seem to be going anywhere. The BioLab people got my number somehow because they started adding me to their email list. They got some PR firm out of New York to handle their crisis comms. They set up a hotline for people to call and tell them if they still see smoke in the air, I guess. They also are going to cover the hotel bills for people who are displaced. Our friend Anila Yoganathan over at BizCron reported that story. By the way, she's been doing excellent work on this story, so please check her work out. and it's just a whole lot of when is the smoke going to clear? When are we gonna learn more about what's been in the air the whole time? And our guest today is a friend of mine, Rebecca Grapevine. She's an excellent local journalist. She's working for a new website called HealthBeat, and she's been doing a great job covering the BioLab fire as well. And she's going to talk to us about that and some other health issues that are going on in Georgia.
Let's chat with Rebecca now.
And joining us now is the reporter with the best name in journalism, Rebecca Grapevine. Rebecca, how are you today?
I'm great, Dan. Thanks for having me.
So for those of you who don't know, Rebecca is a reporter for HealthBeat. It's a new website. So tell us a little bit about HealthBeat and what they do.
Sure. HealthBeat is a new nonprofit newsroom. We've got a bureau here in Atlanta, one in New York, and we're focused on covering local public health news.
So you've been doing a lot of coverage recently on the BioLab fire. It seems to be the story that doesn't end. What is the latest on BioLab? I know they had a press conference yesterday. They've got a new PR agency. What can you tell us about BioLab and what's happening currently with that situation?
Well, you're definitely right that it's the story that doesn't end. At the press conference yesterday, the county chair of the county commission, Oz Nesbitt, said that he doesn't know when this will be over, that they're working to ensure people's safety, but there is no defined timeline as to when things will get back to normal. And that jives with some experts I spoke to this week who've dealt with situations like this. They said it could go on for a while.
So I read on some of your coverage that residents have been finding debris from this fire, and they're kind of getting conflicting advice on what to do about it. What is the story there?
Yes, people are finding debris both on businesses and in personal property. At the press conference yesterday, an EPA official said he would get some gloves and just put it in a bag and throw it away, and that he wasn't concerned about it being contaminated. But BioLab has stood up a website and a hotline where people can call and ask for them to come out and have their team remove the debris. So that's another option if folks aren't comfortable touching it.
So that sort of illustrates one of the key frustrations of this whole thing, is that it seems like the messaging around this is all over the place, whether it's from public officials or state health officials or local elected officials. Why is that? Why has the response to this been so scattershot?
Well, anyone who lives in Metro Atlanta knows that we have so many jurisdictions. I mean, if you look at Rockdale and Conyers, that's 2 jurisdictions already. Then you've got the State Environmental Protection Division, you've got the Federal Environmental Protection Agency, and you've got BioLab involved. So yeah, it has been hard to get unified messaging across. They haven't held daily press conferences, but they have held some press conferences to get messages out. And there's just been a lot of confusion. If you're in DeKalb County, you might have heard something different than if you lived in Rockdale County.
So one story you wrote that we ran concerned what exactly is in the air, and we've been told it's chlorine. It's chlorinated product, right? Do we know what else could be there?
I've spent a lot of time learning about air quality and talking to experts, and you're right. Chlorine and chlorine compounds are one of the main chemicals that seems to be in the air. The EPA right now is mainly testing for chlorine and hydrogen chloride. I spoke to a Georgia Tech professor. He has his own, I wouldn't say home-built, but custom-built air quality monitor, and he brought that out to Conyers to help reassure the local community. He said that's mainly what he's finding as well, too, chlorine in the air, below what the EPA considers an action level, but maybe above what most people feel comfortable with.
So another story that you've been doing great work on is what's going on with the state health board. And I was surprised to learn that they haven't really been meeting a whole lot. What is going on there? The state health board, what is it? Are they supposed to meet? Why aren't they meeting?
Sure. So I'm a public health reporter, so a big part of my job would be to cover the State Department of Public Health, and that department has a board. The department itself manages around $800 million budget a year. You probably know them from COVID times. They do a whole host of things like inspecting restaurants and promoting, infant health. This board has regularly scheduled monthly meetings, but they've now canceled those meetings 5 months in a row. In fact, they were supposed to be meeting this afternoon, and that meeting got canceled. They've only met 3 times this year, and it's disappointing to some people.
It seems in the midst of a public health crisis like a chemical plant fire, an emergency meeting would be expected, right? Much less, the regular meeting. Have you gotten any explanation about why these meetings aren't happening?
Well, the Board of Public, or the department, a spokesperson for the Department of Public Health told me that, there's no law that they have to meet every month, that sometimes they get busy, sometimes they have to cancel for holidays, she said, and that even though the board isn't meeting, activities are still going on at the Department of Public Health. But some advocates I spoke to said that's not enough. They said they want to know what's happening, and it's, can be difficult to find out without those meetings.
So who serves on the health board, and how do they get to be there?
Yeah, that's a great question. So there are 9 members on the board of the Department of Public Health. Most of them are doctors, and they're appointed by the governor and confirmed by the state senate, and they sit on that board for 3-year terms each. There's a chairman, there's a vice chairman, there's a secretary, just the things you would normally expect with a board.
And have you been able to talk to any of the board members since this transpired? Have you gotten any of them on the phone, via email?
I've spoken to one. His name is Greg Lang. He used to run a clinic in Gwinnett County. And, he told me he was a little disappointed. He's relatively new to the board, so he's not, doesn't know all the ins and outs of what's happened in the past. But he said he thinks he has a lot to offer, and, he wants to play more than just an FYI role, he said.
Who calls the meetings? Is it the board chair? Is it the state health director? Who's responsible for saying, we're going to have a meeting today?
That's a great question. I didn't get a clear answer on that. I would imagine it's some combination of the Department of Public Health Commissioner, Kathleen Toomey, who you might remember from COVID, and the board chair.
So is this inhibiting the public health response to this issue at all in any way that you can see?
To the BioLab issue?
Mm-hmm. Or to any issue, frankly.
Yeah, that's a good question. The Department of Public Health says no. We're still going on with business as usual. In fact, we're really busy, and we're taking care of all the things we need to be taking care of. But people I spoke to in the community, for example, one open government advocate said, look, Georgia has really high maternal mortality rates. We have high HIV rates. We have, any number of things going on at any time, and to have the board meet and to give feedback to the agency and to give information to the public would be a really good thing. You'd think the board would want to meet at a time like this, is what he said.
So where does that story go from here? Do you think the board's going to meet before the end of this year, or are things going to continue business as usual?
They told me that they're planning to meet in November, so that would bring the total up to 4. And I will definitely be watching that meeting. The meetings are held virtually, so you can watch at home too and kind of see what happens at one of these meetings. And they could potentially meet again in December, or they could cancel the meeting.
Well, I would expect nothing less from Rebecca Grapevine. I'm sure you'll be there if they are meeting. In October, we are marking Domestic Violence Awareness Month, and when we were talking about topics for this show, this was one that Rebecca pitched to us, and this is going to sound like a really dense question, but I promise it's not. Why are we framing domestic violence as a public health issue? Why should it be considered in that regard?
Yeah, that's a great question. And I talked to the people at the Women's Resource Center to End Domestic Violence, which a lot of Decatur residents might know. It's right there in Decatur. And they said, look, we do think about domestic violence as a public health issue because there were 119 deaths due to domestic violence in Georgia last year, and those were all premature and they were all preventable. They said there are things we can do to prevent this, and if as a society, as a community, we work towards that, we could prevent many or even all of these deaths.
In what ways were they preventable? Can you give me some examples?
Yes, for example, one thing they said that's really important is early intervention. So, if somebody is having issues, that you can help them get to a place where it's not going to end in death. They also said that, we need to bring like a non-shame-based approach to this. So we can't, give somebody who's experiencing this a hard time and say, why don't you just get out? It's not so simple, but that there are ways that you can give people options and walk alongside them. And most strikingly, they said that 80% of those deaths in Georgia involved a firearm. and that the chances of a domestic violence death go way up if there's a firearm present. So it's that merger of some people thinking about firearms as a public health issue and thinking about domestic violence as a public health issue, and here they are overlapped.
If you have a domestic violence conviction on your record, are you able to go get a firearm in Georgia?
That's a great question. I'm not sure about the answer to that.
We had a domestic violence situation that occurred in Decatur a few years ago, and we looked into that as well. And there doesn't seem to be, from our perspective, it didn't seem like it was enforced if there was a rule against it. What advice would you give to anyone who's in a domestic violence situation right now?
Well, the Women's Resource Center to End Domestic Violence emphasized to me that they're available to help people in Decatur, in DeKalb County, and all of Metro Atlanta. That would be a great resource to reach out to. And they're holding a vigil on October 17th at the bandstand in Decatur Square at 7 p.m. And they're going to, honor people who've survived, but also talk about concrete steps people can take to address this issue.
And is there a number they can call or a website they can visit to get some more resources on this?
Yeah, I would definitely Google the Women's Resource Center to End Domestic Violence. They've got all their contact information there. They've got a confidential line you can call and get help, and they're available to help you.
Rebecca Grapevine, thank you so much for joining us. Tell us real quick, how can people learn more about HealthBeat and what y'all are doing over there?
Love it if you reach out to us at healthbeat.org. All our content is free, and we'll soon be launching a newsletter as well. And you can also see our content on Decatur Dish.
Rebecca, again, thank you so much for joining us. We'll hope you come back again.
Thank you.
This is the Decatur Dish Show. We air every Tuesday at 12:30 p.m. right here on Atlanta News First Plus. To check us out, go ahead and download the Atlanta News First Plus app. You can get past episodes of this show. You can get access to all the other great content that our partners at Atlanta News First Plus put out. If you want any other news about Decatur and DeKalb County, please visit decatorish.com. And if you are so inclined, if you appreciate the work that we do, please visit supportyourlocalnews.com and contribute to our fall fundraiser. With that, we will see you all next Tuesday at 12:30 p.m., and we hope you all have a great week. Stay safe, everybody.